Hello, I'm Dr. Bill Waggoner. Welcome to today's Tuesday Tip. Every now and then I like to peruse the pediatric dentistry forums on Facebook. I usually look at the International Association of Pediatric Dentistry, the Pediatric Dentistry Forum, and the Collaborative Pediatric Dentist, also known as IPEDO. The first two groups that I mentioned are largely populated by international pediatric dentists, and it's interesting to me to see some of the cases posted, as well as some of the questions and comments. I came across a post in the Pediatric Dentistry Forum this past week that caused me to pause and reread the post. The doctor, whose name I'm keeping redacted, was advocating a pulpectomy and a full root canal obturation with ProRoot MTA in an abscessed first primary molar. In this picture, you can see the before and after of the tooth, as it was posted on Facebook. Now, upon seeing the post, I immediately went to the comments section to see what others had to say about this post. But before I continue with the posted comments, let me say that while MTA has been shown to be an excellent pulpotomy and pulp capping material in both primary and permanent teeth, none of the MTA manufacturers recommend its use in non-vital primary teeth. Now, it can be used for apical closure in non-vital permanent teeth, but remember, MTA is essentially Portland cement, and it's not considered to be a resorbable material. Now, fortunately, in the comments section of this Facebook post, several pediatric dentists pointed out that the use of MTA as an obturating material in primary root canals was not recommended, although one person noted they might consider it if there was no permanent successor. To my interest, the author of the post doubled down and responded that MTA would resorb and that he or she had over 40 cases that they were following. They indicated that they intended to write those cases up in the future. Now, here is an earlier post from the same dentist that does demonstrate a 3-year follow-up on another case, and it shows the unimpeded eruption of a bicuspid underneath an MTA-filled primary molar. This doctor also commented that ProRoot MTA does not stain teeth, but that's not correct. ProRoot MTA contains bismuth oxide, which will stain teeth. As you know, NuSmile has two MTA products, Neo MTA 2 and Neo Putty. Neither of these materials cause staining because the bismuth oxide has been removed and replaced with a non-staining compound. Both NuSmile MTA products are excellent, but they are not recommended for obturating primary molar root canals. Until there's some actual data in the literature about the resorbability of MTA in primary teeth, I strongly recommend not using MTA on non-vital primary teeth. So, even though we all know the old saying, if it's on the internet, it must be true, don't change the way you practice based on one dentist claiming, quote, "It works great in my hands," end quote. Well, that's all for now. Thanks for watching, and I'll see you next time.